members of our New Jersey family to COVID-19 related complications. We have now lost a total of 537 precious souls. Their memories are in our prayers. God rest each and every one of them. Our prayers and thoughts and sympathies go out to their family and friends. Judy will give you some more dimension on this and some more color, but I'll just, as a headline, as a teaser to when you speak, Judy, you should not assume that 182 people passed since yesterday's press conference. There is a lag here in terms of confirming cause of death in particular, and Judy will get into that in detail. So it's tragic. Every one of these lives is a life lost. Let me be unequivocal about that. But in terms of how these have actually transpired and these blessed folks have left us, I think I would just say, as a non-medical professional, you need to think of this over a span of days, and particularly given the stress right now that we have on the system, that is more true than ever. I think Judy will tell us that even in a normal, regular time of peace, that there is a lag associated with this, and there's an overwhelming challenge, as you can imagine right now, given the stress we're going through. One of those precious lives lost was Kim King Smith, an EKG technician at University Hospital in Newark. Look at her blessed picture. She worked the night shift and was part of the University Hospital family for 13 years. And I might add, on an interim basis, Judy Persichelli ran University Hospital and was the head of that organization. And I want to thank you for that, Judy. We haven't spoken about that enough. As the current University Hospital president, Dr. Sharif El-Nahal, a true friend to those of us up here, as he noted, her family is saying her smile was, and I quote her family, more infectious than the virus that took her life. She was a front-line hero. God bless her and God rest her soul. We also, by the way, if we had our druthers, we'd speak about each and every single one of these lives. We can't, but I want folks to know that that would be our preference if we could. But each and every one of them are in our hearts and prayers. We also lost veteran Hudson County Sheriff's Officer Bernard Waddell. I had the opportunity, there he is, God bless that guy. I had the opportunity to speak with his wife Sheila and his son Bernard, by the way, also a member of law enforcement, yesterday afternoon to extend our families and our state's condolences and appreciation for his 28 years of service. He too was a frontline hero. I also spoke with Hudson County Sheriff Frank Scileri, exchanged notes with the County Executive Tom DeGise. This is not abstract for them as it is now not for so many. And we learned as well that we lost Montclair's own Adam Schlesinger, an award-winning musician and songwriter. There's a good shot of Adam, bless his heart, and a founding member of Fountains of Wayne, which not only made its mark, but whose very name memorialized the iconic store on Route 3 that Adam remembered from his youth. He was Jersey through and through, and the lights of the art scene and our art scene are a little dimmer today. We keep each of them in every single one of these lives in our hearts and our prayers. Again, every single member of our great New Jersey family who we have lost. And may each of their memories provide strength to the families and friends left behind. And as they say in the Jewish tradition, may each of their memories be a blessing. Again, I know these numbers are stark. They are certainly sobering. They are shocking, and they are indeed sad. And as I said, Judy will get into giving you some sense as to how this is really building over a period of days. But I want to say this, we can lower these numbers, and we will. We could see fewer of our New Jersey family pass because of COVID-19. And the way we do that is by aggressively and continuously practicing our social distancing, even under the most extreme of circumstances. In fact, I and my team have spoken with and have exchanged notes. I just literally exchanged one with them within the past hour with Passaic Mayor, dear friend Hector Laura, their great fire chief Peter Trentacost, and State FMBA President, another dear friend Eddie Donnelly, and Passaic FMBA President Dave Montalvo. Passaic, as I mentioned, suffered a tremendous loss on Monday with the death from COVID-19 complications of young fireman Israel Tolentino. I mentioned that I had spoken to his widow and spoke to her about his life and their children and how they were doing. They obviously wanted to be part of a proper send-off for their fallen brother. But as we discussed, this is not an ordinary time, and it just simply can't be done. So the Passaic Fire Department will pay their respects by driving past the funeral home to let firefighter Tolentino's family know they are there with them in spirit. And once this emergency ends, and it will, and we will come through this together, they will gather as one to memorialize him. This is leading by example, again, even in the most painful times. If you do not need to be out, then we need you to stay at home. Please, God, stay at home. And even when you're at home, keep your distance between yourself and other family members. We need to make sure we're doing all that we can to support the folks who we need working the front lines in whichever essential jobs they have. And I want to give a particular big shout out today to all our transit workers on both the bus, the rail, the support side, who are helping many of our essential frontline workers actually get to their jobs. And by doing so, they are also heroes. They are also at the front lines. Now, I know it is a beautiful day. I know you want to get outside and go for a walk or a run or talk with your neighbors. You could do that, but only at a distance. Keep that critical minimal 6-foot distance between you and anybody else. If you're out for a run, give others you pass a wider berth. And as we keep ourselves healthy, we keep others healthy, and we do our best to flatten that curve that we've looked at so often. We are all in this together. Do it for yourself, do it for your family, do it for your community, and frankly, do it in memory of the likes of Kin and Bernard and Adam and Israel and everyone else we've lost. It's what we need to do. Please. Switching gears, as we often do up here. This morning, Colonel Pat Callahan and I had the opportunity to tour the Field Medical Station, which I believe, Pat, is the formal name for what is really a temporary field hospital being set up at the Meadowlands Exposition Center in Secaucus. In fact, it is set up. We were joined on our tour by Senator Bob Menendez, and I cannot say enough good things about Senator Menendez and Senator Booker and our entire congressional delegation in fighting for our state in Washington throughout this emergency. And by the way, the fight isn't remotely done. And I also, Pat and I were also joined by the Commanding General of the U.S. Army Corps of Engineers North Atlantic Division, Major General Jeffrey Milhorn, who's become a good friend, and Lieutenant Colonel David Park, who sat about where Elise and John are sitting today, of the U.S. Army Corps of Engineers, who heads the Philadelphia district in which we find ourselves. I also want to give Colonel Callahan and the troopers a big shout out for their extraordinary efforts. That site, with a minimal, depending on how they configure it, at the moment it's configured for 250 beds, is nearly ready to be put into service. I think they're going to have a soft opening, as they say in the retail business, on Monday. And I thank the women and men of the Corps, our partners at FEMA, and the state troopers, and also the administration for availing this necessary service to us. This is the first of what will be at least 3 such field medical stations in our state, with Edison and Atlantic City to follow, which will expand our bed capacity by at least 1,000 beds in total. And as Commissioner Persicelli's briefing today, and frankly I think every day, will show, they're coming online not a moment too soon. And of course we've talked about 4 of these, 4 times 250, just to remind you, for the current configuration at least, Edison is actually 2 of them together and will be 500 beds there. We will need not only the capacity, but the great flexibility these sites will afford our bricks and mortar hospitals in the coming weeks. I want to give a shout out at this time to United Healthcare, which is dedicating 2 of its senior folks to work with the Department of Health to assist us in our efforts. We are proud to welcome Dr. Jeffrey Brenner, the Senior Vice President of United's Clinical Redesign Team, excuse me, and Kathleen Stillo, the President and CEO of Clinical Redesign. Dr. Brenner is a family physician by training, and Kathleen's career has focused on improving the overall delivery of health care. They will join us for the next 90 days, and we welcome them. We are proud to welcome them both to our team, and we know they are going to hit the ground running. I exchanged a nice note yesterday with United Health CEO Dave Wickman, and thanked him personally for the assist here, which is big. Of course, we continue our work to get the equipment and supplies that all of our healthcare providers and hospitals and workers need from all possible sources, including the federal government, our federal government partners, our state supply caches, individual and corporate donors, as well as private sector procurement. Today, I am signing, to that end, an executive order formally authorizing Colonel Pat Callahan, to my left, to commandeer medical supplies and equipment that are necessary for our COVID-19 response. This may run the gamut from N95 masks and other personal protective equipment to ventilators and everything in between. While we look forward to these facilities cooperating with us and providing this equipment as needed, this order gives Pat the express authority to requisition it for distribution to our acute care hospitals and other healthcare facilities, and needless to say, they badly need the equipment. But we also all certainly hope that Pat doesn't have to use this authority. We would hope that folks would step forward and do the right thing, but if need be, we will use this authority. Speaking of people stepping forward, additionally on the topic of PPE, we learned yesterday that Horizon Blue Cross Blue Shield has committed to donating a total of 500,000 N95 masks and 81,000 face shields to our response efforts. That's more than $2.3 million worth of supplies. These supplies will be delivered throughout the month of April. Horizon is also making both a $100,000 donation to the Community Food Bank of New Jersey and $60,000 to the Jewish Family Service of Atlantic and Cape May. This is a good reminder that it's not just our frontline healthcare workers, it certainly is that group, and first responders certainly, and other essential workers who need our help at this time, but that there are also countless everyday New Jerseyans and their families we can't forget. And I thank Horizon for remembering that our entire New Jersey family needs help. I mentioned that article in the New York Times, quoting one source, that 70% of the people who were pulling up to food banks in that certain area were doing so for the first time in their lives. Horizon has told us this all amounts to the largest single donation the company has made in its 88 years. So to Kevin Conlon and their entire team, bless you and thank you. As always, if you have any PPE to donate, please get in touch with us through our one-stop online portal and head to covid19.nj.gov/PPE donations. And we will gladly accept your donation, no matter how large or small. Every little bit counts. I also signed an administrative order today permitting blood drives to continue to ensure we can meet the critical medical needs of our residents. Judy spoke eloquently to this a few days ago. In order to operate, blood drives must undertake appropriate mitigation efforts to prevent the spread of COVID-19, including, needless to say, incorporating social distancing where practicable. Switching gears again for a quick note on testing of our 2 FEMA partnered public drive-through sites. A reminder that tomorrow, April 3rd, only Bergen Community College will be open. The PNC Bank Arts Center site will be closed. Testing at Bergen Community College will begin at 8 a.m. and you must be both a New Jersey resident and exhibiting symptoms of respiratory illness. If you do not meet either of these requirements, you will not be tested. Again, let me repeat this. In a perfect world, I'd love to be South Korea. I'd love to have unlimited supplies from the feds of that which we need to collect these specimens. I'd love to have unlimited personal protective equipment to protect our healthcare workers who would take these specimens. I'd love to have unlimited duty supply of healthcare workers to be able to both test everybody and care for those who are sick. We don't live in that world. We live in a world of limited resources, particularly coming out of the federal side. We're grateful for what we've got, but it's a fraction of what we need. And so we made a decision right from the get-go that we needed to test those who were exhibiting symptoms for the obvious reasons that these folks are sick, whether or not they've got COVID-19 to be determined. It turns out 6 in 10 do not have it approximately so far, and that's an important point to make. But for the folks who do have it, we can be much more aggressive in treating their symptoms. And as Dr. Tan reminds me, even if they don't have COVID-19, they're sick. So they've got to, they're not Superman or Superwoman here. They've got to go back and take care of themselves. But that also gives our healthcare professionals a high quality trove of data that we need. I know folks would like to say, gosh, wouldn't it be nice if you had a spread between symptomatic, asymptomatic? In a perfect world, yes. We don't live in a perfect world. And that's the world in which we find ourselves at the moment. Additionally, I think this is now over 33 different places at a minimum. Mercer County is now operating an appointment-only drive-up testing site at the Quaker Bridge Mall in Lawrence Township for county residents. This site is open weekdays from 8 a.m. to 4 p.m. To receive an appointment, your doctor must send notification to the site that you meet testing requirements and are symptomatic. Again, we repeat, you got to be symptomatic. Those who show up and do not have an appointment will not be tested. If you live in Mercer County and you are symptomatic, please contact your primary care provider. We have a comprehensive list of all publicly available testing sites, not just what I hold up in my hand, but it's online at our one-stop portal. Either scroll down on the homepage to the graphic for COVID-19 testing information, or go direct to covid19.nj.gov/testing. That's a little bit of an eye chart there, but it's at the bottom, covid19.nj.gov/testing. And again, for all testing, you must be symptomatic. Switching gears again, please, if you could bear with me to highlight a couple of announcements from elsewhere in our administration. This morning, the Department of Labor reported that over the past week, more than 206,000 new claims for unemployment were filed, meaning that in just the past 2 weeks alone, more than 362,000 residents have filed for unemployment. You no doubt saw the national numbers, also record-setting. And we are also very cognizant that there are delays and backups in the system, and we urge everyone to please have patience and that your claim will be taken care of, and you will not lose one penny of your benefits. But on the other hand, we do have literally thousands of opportunities for employment at essential workplaces listed online. If you want to work and help us as part of our response team, please visit again covid19.nj.gov and click on the link for Jobs Portal under the search bar, or you can go directly to jobs.covid19.nj.gov. And again, we thank the 500 employers who have worked with us to put their available jobs online. I don't know what the number looks like today, Mahan, but I know yesterday, I believe it was 44,000 job offerings were on that website. So it is multiple tens of thousands of job openings. Next, the Department of Education, NJTV, and the New Jersey Education Association have partnered to begin NJTV Learning Live, a new public television program featuring lessons taught by New Jersey's tremendous educators, best in the nation, best in the world. Starting on Monday, each hour-long weekday program will offer programs for grades 3 through 6 and will cover subjects including English language arts, math, science, social studies, and will also include art, music, or physical education. Third grade instruction will begin at 9 a.m., fourth grade at 10 a.m., fifth grade at 11 a.m., and sixth grade instruction at noon. Again, that's third grade at 9 a.m., fourth grade at 10 a.m., fifth grade at 11 a.m., and sixth grade at noon. And all will be aired on NJTV. I cannot thank enough NJTV and NJEA for working with Commissioner Dr. Lamont Repillette and his team at the Department of Education. And especially, again, a huge shout out to all of our extraordinary educators up and down this state. Switching gears again, Attorney General Gabir Graywal's office has made public what I would like to refer to as the first members of Knucklehead Row, 6 individuals who have been criminally charged for assaulting law enforcement officers by spitting or coughing on them while claiming to have COVID-19. Let me be clear, we are taking a zero-tolerance policy against anyone who acts so stupidly and puts others in danger or makes them fear for their health. These are not slaps on the wrist either, by the way, folks. If you engage in such reckless behavior, you're going to face, at the very least, fines of up to $10,000 and up to 18 months in jail. I am proud of the work our women and men in blue, our county prosecutors, and the Attorney General do on these cases each and every single day. Pat, before we go to questions, in a few minutes, would you mind giving us an overnight compliance report? Thank you for that, sir. And I think this is as good a point as any to wrap up. But before I do and turn things over to Judy, I know there's a lot of serious news out there, but I'd like to highlight some of the good news across our state to help us remember the extraordinary things that ordinary New Jerseyans are doing literally every day to help us get through this. I want to start by giving a shout out to one of the many, many, many true frontline heroes among us. Lorna Mickey McKayabus. I believe Mickey is the third from the right in that picture, in the whitish color shirt. She is one of the terrific nurses at Hackensack Meridian Health Palisades Medical Center in North Bergen. There she's gathered with a group of colleagues, along with my wife, First Lady Tammy Murphy. Mickey is a recovery room nurse who has stepped up to the plate and is now working in critical care, treating COVID-positive patients, all of whom are on ventilators. She is a 33-year nursing veteran, and I know that she is putting that tremendous work experience to work. To her and everybody at Palisades Medical and in every single one of our hospitals, you are our superheroes. Mickey is just one example of thousands, literally, of others doing the right thing to help us get through this and emerge stronger. Some are nurses, some are business people, some are just everyday New Jerseyans. Some, as I mentioned, are working at NJ Transit or in retail, essential retail like supermarkets and pharmacies. But each and every one of them deserve our thanks. And I encourage you, by the way, if you could, to tell us their stories. When you meet one of these heroes, use the hashtag NJThanksYou so we can share them with our state and spread some hope and optimism and perhaps some good humor at a time when we are all desperately in need of it. And I'll highlight some of them in the days ahead. Remember, folks, we're not at the beginning of the end, and I'm afraid to say we're not even at the end of the beginning. We have a tough, tough road ahead of us, and it's already proven to be a tough road. Look at the lives, the hundreds of lives lost. The numbers are going to keep going up. Sadly, fatalities and certainly positive test results. Again, the positive test results do give us a window into how best we can manage this. But it's more important than ever before that we all hang in this together. We are one New Jersey family. Again, extraordinarily, even in these moments of social distancing, at staying at home, of isolation, there's a bond we have begun to develop unlike any time ever before. Let's let that continue to flourish and remind each other that we're all in this together. And just as extraordinarily, we are on the one hand, the most diverse state in America, And yet no state rises and falls as one family more so than New Jersey. We are all in this together. And as I've said to you, this is war. And you don't win a war by panicking. And you also don't win a war by going business as usual. You win a war like World War II, like other wars that we've won over the centuries, by being smart, aggressive, proactive, straight with each other, not kidding around about what the facts are and the enormity of the task before us, by acting as one and never turning on each other, by working harder than anybody else, by showing courage more so than anyone else. That's New Jersey. That's not just American values, which it is, it's Jersey values. And if we all do our share, each and every one of the 9 million of us in our family, we will not only get through this, not unscathed, sadly, not without mistake, I'm sure, but we will get through this, whenever that is, stronger and more united as one family in New Jersey than ever before. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. As we see the number of cases increasing across the state and the pressure on our hospital systems building, we are preparing to release that valve by standing up alternative care sites. We are expecting the field medical station in Secaucus to be available early next week for what the governor has appropriately called a soft opening. This site will take individuals with lower acuity from the surrounding hospitals, so these hospitals have more space to care for the critically ill. The field medical sites are being set up for non-COVID-19 patients. However, the staff working at these sites will be prepared to care for individuals who may develop COVID-19 while at the field station. As I've outlined previously, the state is separated into 3 regions, with the Level 1 trauma centers organizing resources and needs for the hospitals in their specific regions. The Level 1 trauma centers are well positioned for this role, as these are the hospitals that have the ability to transfer individuals by ground and also by air medical transport. The Level 1 trauma centers will work with hospitals that need to decant their hospitals of individuals who have the lower acuity of care and can be placed safely in the medical field station. We're working closely with University Hospital right now in the northern region who will coordinate the transfer of patients to the Secaucus facility. The field medical station, which can accommodate up to 250 patients, will be led by a chief medical officer and a chief nursing officer. The staff complement at this site will include physicians, registered nurses, physician assistants, advanced practice nurses, respiratory therapists, behavioral health workers, and social workers. Staffing was obtained primarily through our volunteer portal, as well as through temporary agencies and the National Guard. Some of the services that will be available include everything you would see in an acute care hospital: radiology, pharmacy, and lab services. We have a full team there to meet not just the medical needs, but also the mental health needs and the discharge planning needs of the individuals who will be there as patients. This site will be a valuable resource for our northern New Jersey hospitals who are already experiencing increased demands for care. As I noted yesterday, the night before, 7 hospitals were on divert. Last evening, only 4 were on divert, and they were different than the ones the night before. So as hospitals are managing their volume, they are moving patients along appropriately. As I've said, we expect this pressure on our healthcare resources to continue as we see the increasing number of cases in the state. As the governor mentioned, we are reporting 3,489 new cases for a total of 25,590 cases in the state of New Jersey. Sadly, as reported, 182 new deaths have occurred. However, In order to report the most accurate statistics, our communicable disease service is now including data from our electronic death certificate service. Today's report includes 124 from our communicable disease service and 58 deaths from the electronic death certificate service that have occurred over a number of days. 17 of these new deaths were associated with a long-term care facility. Of the new deaths, 45 were from Bergen County, 30 from Essex, 21 from Middlesex, 15 each from Hudson, Morris, and Ocean counties, 14 from Monmouth County, 7 from Passaic County, 5 from Union County, 3 each from Burlington and Camden counties, 2 from Somerset County, and 1 each from Atlantic, Mercer, and Sussex. And we are still gathering county of residence for 4 individuals who have passed. Our thoughts and prayers are with these families who have lost their loved ones. Overall, we're reporting 537 deaths, 59% are male, 41% female, 47% are over the age of 80. 35% have documented underlying conditions such as cardiovascular disease, obesity, diabetes mellitus, chronic lung disease. 14% or 76 deaths are associated overall with long-term care facilities. The county breakdown of the new cases is as follows: Atlantic, 9, Bergen, 300, Burlington, 39, Camden, 56, Cape May, 12, Cumberland, 4, Essex, 205, Gloucester, 19, Hudson, 220, Hunterdon, 14, Mercer, 47, Middlesex, 223, Monmouth, 118, Morris, 90, Ocean, 97, Passaic, 128, Salem, 3, Somerset, 47, Sussex, 16, Union, 152, and Warren, 15. And we're still gathering more details on 1,675 of these new cases. At this point, 110 of our long-term care facilities in the state have reported at least one COVID-19 case. As stated previously, we are concerned for our most vulnerable populations and long-term care facilities, psychiatric hospitals, group homes, and prisons. We continue to monitor all of these areas closely and on a regular basis. Along with the governor, I want to thank all of New Jersey residents who are following the guidance to stay at home. Social distancing is the best tool we have to slow the spread of this illness. The importance of social distancing was underscored by a CDC study released yesterday that demonstrated that transmission can occur also in the absence of symptoms. We know the pressure on the healthcare system will escalate as cases increase, and that's why we're urging the public to take personal responsibility to reduce the spread of COVID-19 by staying home. We are all in this together, and we must take steps to protect one another. Thank you.
Judy, thank you for everything you and your team are doing. Extraordinary work in an extraordinary time. A couple of things, again, just to make sure I've got this right. 110 long-term care facilities have at least one positive. The denominator, again, is 375 for folks watching. So that's, I guess, about a 30% ratio. And I know you're watching that. You're watching homes for developmentally disabled, psychiatric hospitals, prison communities, et cetera, where you've got an intense, and to repeat something again, if I get this wrong, you'll correct me, but the reality of asymptomatic folks coming into those areas or facilities of high concern is a particular concern that we've got, right? In terms of masking, I guess you've already put the word out, complete masking at long-term care facilities, by example, right? Top 5 counties in total cases, I won't go through the numbers, but this is a list you've heard before. Bergen continues to be number 1, Essex number 2, Hudson number 3, Union 4, Middlesex 5, and Passaic is right behind at number 6 in terms of total cases. Again, the reality on the blessed lost lives is you've got a mix of folks really, again, Judy, I don't want to say this incorrectly, but you've got a mix of folks who we know passed at a certain moment of time from a certain cause, but you've then got some others that you're bringing in over time. Is that fair to say? Yeah. And is that time frame a number of days usually? Christina?
It really depends. The electronic death certificate data are relatively recent information. The issue is the challenge of sometimes there might be some errors in the death certificate data. And of course the other information that we get through our communicable disease system takes a little bit longer to follow up on.
And as we have, and again, I don't want to get this wrong, but as we have said, I believe almost at every one of these gatherings, just one other thing on the positives. Did you mention the positive ratio? I apologize.
I did not.
So that's something that folks should hear. I gave approximation, but Judy's got the exact number.
Of the total number of tests performed, 56,915, 23,395 tested positive, for an overall percent positivity of 41.11%.
So just, again, a couple of things that Judy and I have been pounding away. Dr. Tan has been helping us make these points. Number one, that means approximately 6 out of 10 people who got tested negative. Mm-hmm. Secondly, Dr. Tan wants me to remind you that you're still sick, so take care of yourself. Thirdly, it's overwhelmingly symptomatic people. So this is not an average slice of the current state of the state. These are folks, as you heard me say on these testing sites, you got to be symptomatic or you'll get thrown out of line. Now, we can't say that's the case in every single test, but overwhelmingly that's the case. And Judy, we are now 12 days removed from the last most aggressive steps that we've taken in terms of shutting the state down. These test results that we're announcing today are probably somewhere in a 7 to 12 day ago specimen collection. Is that fair to say?
Yes.
So we're still a week or so away from really knowing what that last set of actions that we took, what impact that has on the positives. Is that?
Absolutely correct. We're getting calls at the Department of Health. People have been tested and they're waiting 10 to 12, sometimes up to 14 days for their results because all of the labs are overwhelmed at this point.
There was something, I got accused of being rosy on a couple of things earlier. I don't think this has been rosy in any way, shape, or form, but one of the statements you heard us say probably a week or so ago was that the scarce resources were the collection materials from the feds to take the specimen, the PPE, and the healthcare workers. A week or 10 days ago, it wasn't the testing labs. That reality has changed. Now all of the above are scarce resources. The materials we need to collect the specimens, the PPE to protect the workers, the healthcare workers who, as I said, we're facing forks in the road all the time between testing and care. And then lastly, I think CNN reported last night, was it Quest, Dan or Mahan, that had a backlog, I think, of 20,000 at one lab alone. So there's limited resources or constraints in the entire system right now, not just in New Jersey, but in America. So I think I'm probably being charitable on the 7 to 12 day window right now based on the backlog. Judy, again, thank you for everything. Dr. Tan, thank you. Before we go to Christine, Pat, any quick words either on compliance, field hospital? You guys did an incredible job. PPE.
Just real quick overnight, 6 what we would call COVID-19 related incidents. a funeral in Lakewood that had 60 to 70 people in attendance was broken up. 15 people were charged with the violations, and one gentleman was charged with disorderly persons and hindering an investigation. Subject under arrest for a controlled dangerous substance in Edison claimed to have the coronavirus and coughed on the arresting officer. Newark issued 130 separate violations and closed 4 businesses. A Jersey trooper responding to an accident up in Morris County. The driver of that car was found to be wanted, and while arresting her, she drooled and spit on him, claiming to also have the coronavirus. There was a party, a social gathering up in Morristown, where a subject was charged with violating the executive order. And lastly, a dispute at a tow yard where the subject, arguing with the tow truck operator, claimed to have the coronavirus and was going to spit on the door handles of his vehicle. I was pleased to see what the Attorney General did in his announcement yesterday, that is not disorderly conduct, that will be treated as an aggravated assault if warranted. So I appreciate that, Governor, and to the Attorney General. As far as PPE goes, that's an ongoing conversation, as we all know. The donations are greatly appreciated. A lot of things in the pipeline, a few things back ordered. It's a hourly conversation, and as you said this morning, just a phenomenal effort to watch that medical station go up in 6 or 7 days. Just truly a phenomenal effort by local, county, state, and federal partners. So it was something to see. Thanks, Gov.
Again, the vast majority, and Pat, I think you'd back me up here, the vast majority, Jared, of folks in New Jersey are doing the right thing, and we are eternally grateful for that, and you will be rewarded for that behavior, if not before, in heaven, so thank you for that. But the vast minority of complete knuckleheads, I mean, the sort of behavior you're talking about, and it goes from sort of the more benign, hello, you can't have a gathering, all the way to this sort of aggressive, awful behavior of spitting on people and threatening and whatnot. We've got to eradicate all of that. We need 100% compliance. Again, I wouldn't bet on any other state to achieve that other than this state. So I know we can achieve it. I'm looking forward to one of these days we have a compliance, anything going on, and Pat says I got a goose egg. Secondly, we're wargaming. We're working on plans on all the alleys where we've got challenges as this builds to a crescendo, whenever that may be. And we're grateful for all that we've gotten, whether it's from the federal government, from private donations. We're grateful for the folks who are volunteering to serve. But again, ventilators, personal protective equipment, beds, healthcare workers, we're not in any of those places where we need to be. Again, we're trying to war game that and try to stay ahead of it as best we can. And the work that's being done by everybody, Judy deserves the biggest shout out, but Pat and the whole teams on sort of trying to figure out how we solve for these huge challenges. You can't say enough good things about them. The one thing we didn't hit today, I want to re-hit the call to arms. Go to covid19.nj.gov. If you want to volunteer to help us get in the fight and augment our extraordinary heroes among our healthcare workers, please go on that website, sign up, and there's a process, Judy. I'm using the phrase matchmaking, but that's kind of what's going on, right? You've got folks who are looking at where the needs are over here, where the volunteers are over here in their particular specialties and licenses, and where we get a match. And we'll continue to do that, and that's happening in real time. But again, I wanted to make sure everybody realizes we're not where we need to be on any of those fronts. We're working to war game and do the best we can to stay out ahead of it, but we have a ways to travel. As we've said all along, it is a whole of government challenge, and it's a whole of government, frankly, whole of society response that will allow us to get there. I mentioned both daycare, childcare for essential workers. We mentioned that this is now Child Abuse Month. There's no better leader in our state than the person I'm going to introduce next to speak to both of those. Please help me welcome the Commissioner of the Department of Children and Families, Christine Norbert-Beyer.
Thank you. Good afternoon, everyone. I'd like to begin by thanking Governor Murphy and my colleagues for all your leadership during these trying times in our state and working so hard to reduce the spread of COVID-19, flatten the curve, and help save lives. I'd also like to offer my sincere thanks and appreciation to the people on the front lines of this pandemic, law enforcement, healthcare workers, emergency responders, firefighters, and our own team at DCF, as well as everyday heroes who are keeping New Jersey functioning during this time. The grocery store clerks, gas station attendants, child care providers, and more. Your efforts to ensure essential services continue for New Jersey families during this pandemic has been nothing short of heroic. We all have a role to play, each and every day, to keep New Jersey's families and children safe, healthy, and connected. And we're seeing that play out during this crisis in the work that's being done through government, private, and nonprofit channels to support families in need. And I have to say, witnessing the talent, the drive, the thoughtfulness, and the ingenuity of our team at DCF and our network of service providers across every community in the state, I could not be prouder to be working in public service and leading this extraordinary department. We know that there are very difficult times ahead for New Jersey as a state and for each of its families individually. We're working around the clock and across state government to support families during this time, particularly families of workers performing essential services for New Jersey during this pandemic. I'm here to share additional details around the partnership announced last week between DCF, the Department of Human Services, and the Department of Education to roll out childcare options for the state's essential workforce. Individuals working in the public and private sectors who were determined to be essential for the continued functioning of the state under Governor Murphy's Executive Orders 107 and 110. And know that if this were a perfect world, all employees across the state would be deemed essential. Earlier this week, our team within the DCF Office of Licensing certified nearly 600 agencies statewide to provide care to the children of essential employees. And today, we're announcing the launch of an emergency child care assistance program, which is being administered by the Department of Human Services Division of Family Development to help support child care costs when a parent or guardian is an essential employee, regardless of family income. In order to have access to emergency child care, essential employees will need to register with their county's child care resource and referral agency. Registered essential employees will then have access to emergency child care assistance support to offset the cost of child care. More details and guidance around the emergency child care program for essential employees, including eligibility requirements around who is considered essential under the governor's executive orders, have been posted to the DCF Corona website and childcarenj.gov. Beyond the availability of childcare, we know that families are experiencing a number of other stressors during this crisis. We know that families and children who were struggling before may become even more vulnerable during this time of elevated stress and social distancing. The research shows that during natural disasters or national emergencies, like what we're experiencing now, families are subject to greater levels of stress and heightened anxiety, just at the same time that parents and children are isolated from their usual forms of support, like time with family, friends, gatherings in school, and community routines and events. Increase in stress coupled with the decrease in support like this can lead to an increase in maltreatment and family violence, including child abuse, neglect, and domestic violence. As we look at the data across the country, and really across the world, in terms of the impact of the COVID-19 pandemic, states are already seeing an increase in incidents of child abuse and intimate partner violence. At the same time, in New Jersey, and as in other jurisdictions, we're seeing fewer referrals to our hotlines and helplines. Social isolation is hard. Every one of us who is a parent knows that every parent needs the support of friends, family, and community. But now we're all less able to connect to natural supports. Families are now less able to connect to the kind of formal help they need, And it's harder for us to know about struggling families during times like these because social distancing means that many of those who serve as sentinels for children and families, teachers, coaches, counselors, pediatricians, and primary healthcare professionals don't have the same level of contact with children and families in communities. So as New Jersey residents abide by and practice the safe social distancing practices that are absolutely necessary, the challenge becomes that the individuals and the professionals who might have otherwise supported families or connected them to help in their community are restricted in their face-to-face interactions. In New Jersey, we're already seeing these effects. 1 year ago, in March 2019, there were 7,501 referrals made to our state central registry, which is our 24/7 child abuse and neglect hotline, for either child protective services or child welfare services. This year, in March 2020, there were 5,117 referrals. That's a 32% reduction. And March is traditionally one of our highest reporting months. The reduction doesn't necessarily mean that children are experiencing less abuse and neglect, but rather that it's not being seen or heard, and so no response is being taken. It's not being reported. This is the other reason why I'm here today. April is National Child Abuse Prevention Month, but our commitment to prevent child abuse can not only happen during April or during times of national emergency. I'm urging all New Jersey residents to do your part to help us prevent child maltreatment and domestic violence. I'm asking each of you to be extra vigilant for those children and families who might be having a hard time right now. If you have a family member or friend with small children, call them, check in daily, see how they're coping, ask them if you can do anything to help relieve their stress. Sometimes just being able to talk it through is enough. Other times, dropping off a meal or offering to help navigate unemployment or other benefits can be the best way to help. If you know a family caring for a child with special needs, this is the time to be the best friend, neighbor, or church community member that you can be. Reach out. Let them know it's okay to feel overwhelmed and that you care about them, and if there's anything you can do to help. If you know parents who are challenged by substance use disorders or who struggle with maintaining good mental health, please get in touch. Ask them how they're handling the stress, and if they need to be connected to a counselor, help is still available. Offer whatever help you can, because at the end of the day, we're all in this together, and it's only together that we'll get through these difficult and challenging times. Through the Department of Children and Families, we're rolling out a campaign to let people know that social distancing shouldn't mean social isolation. The connections you make with your friends, your neighbors, your family members, and your community, they're absolutely vital and can help us bridge the social connection gap during the COVID-19 pandemic. We're partnering with our sister state agencies, community-based prevention organizations, several trade organizations, such as the New Jersey Association of Counties, the American Academy of Pediatrics in New Jersey, the NJEA, the school districts, and more, and pushing out messaging on social media channels, Facebook, Twitter, Nextdoor, to advance this call to action. If you or anyone you know is having a hard time coping, text NJ to the number 741-741. Trained counselors are available around the clock. If you suspect someone is getting hurt in a family you know, please report it. You can call the New Jersey Child Abuse Hotline at 1-877-NJ-ABUSE. To report domestic violence, call 1-800-572-SAFE. All of these resources are available 24 hours a day, 7 days a week. Working together, we can all make a difference for families in need and help them get through this crisis. Thank you, and on behalf of the Department of Children and Families, stay safe, healthy, and connected.
Christine, thank you, and thank you for what you do every day in our administration, but particularly at this time. I was struck in particular by the reduction of reported instances in March, and the big takeaway I suspect many of us have had, is because a lot of those instances get uncovered by a teacher, a coach, a nurse, a member of law enforcement, and the kids are not seeing most, if any, of the above right now because of the lockdown that we're in. And so this is not just timely, but it's particularly poignant at this moment, again, in this month in particular. So thank you for everything, and thanks for your leadership. Before we go to questions, I had an enormous amount of feedback on how we were spending our time as a family personally. I got a lot of questions about, was I favoring one James Bond actor over another, one set of Jason Bournes over another. My kids wanted me to remind you that you can also get, for you soccer fans, you can get on social media 7 to 10 minute summaries of about any great game ever played. And so I'm going to give you my three: the 1996 Euro semifinal between England and Germany, the 1997 Champions League final between Dortmund and Juventus, and one that you won't get here every day, the 1997 semifinal for the Confederations Cup in France between Italy and Brazil. Those are three that we've watched lately and have enjoyed in the midst of this extraordinarily challenging time. Brett, we're going to start with you. Fire away.
Three things.
Hold on a sec.